Extracorporeal shockwave therapy, or ESWT, has become a significant non-invasive treatment in orthopedics and musculoskeletal medicine. Originally developed from shockwave lithotripsy used for kidney stones, ESWT has evolved to address a wide range of conditions, especially those involving bones and tendons. In this video, we'll explore the history, science, and clinical applications of ESWT, highlighting its journey from experimental beginnings to a recognized therapy. Let's start by understanding how ESWT was first introduced and how its use expanded rapidly across different medical fields. Story of ESWT begins in Germany and Bulgaria, where orthopedic surgeons and traumatologists first experimented with shock waves on bones. Early devices such as electrohydraulic and piezoelectric systems were tested for their effects on bone healing. As researchers observed positive outcomes, ESWT's use quickly expanded beyond bones to other musculoskeletal tissues. However, in the late 1990s, enthusiasm outpaced scientific evidence, leading to a temporary halt in insurance coverage in Germany. This setback prompted rigorous multicenter studies which ultimately validated ESWT's effectiveness and revived its clinical use. ESWT devices come in several types, each generating shock waves differently. The main categories include electrohydraulic, piezoelectric, and electromagnetic devices, which produce focused pressure waves. Radial or ballistic devices, on the other hand, generate pressure waves that are less focused and deliver their highest energy at the skin's surface. This distinction is important because it influences how deeply the energy penetrates and which tissues are targeted. Understanding these differences helps clinicians choose the right device for each patient's needs. Appreciate how ESWT works. It's helpful to understand the physics behind shock waves. Shock waves are mechanical waves that travel through a medium, such as water or human tissue, causing temporary deformation. Focusing devices concentrate energy into a small area, achieving high peak pressures and rapid rise times. Radial devices, however, produce slower, less intense pressure pulses that dissipate quickly. These physical properties determine how shock waves interact with tissues and ultimately influence their therapeutic effects. Comparing different acoustic waves, such as shock waves, diagnostic ultrasound, and radial pressure waves, we see clear differences in pressure, rise time, and penetration depth. Focused shock waves can reach deep tissues with high energy, while radial waves are best suited for superficial structures. These differences are crucial when selecting the appropriate therapy for specific conditions, as the depth and intensity of energy delivery can impact treatment outcome. Measuring the effectiveness of ESWT devices involves assessing parameters like pressure, energy flux density, and impulse. These measurements are typically performed in water using hydrophones, but translating these values to human tissue is complex due to varying tissue densities. Accurate measurement and standardization are ongoing challenges in ESWT research, and future improvements in device calibration will help ensure consistent and effective treatment. Therapeutic effects of ESWT are rooted in its ability to trigger biological responses at the cellular level. When shock waves pass through tissue, they activate the cell skeleton, leading to the release of mRNA and stimulation of organelles like mitochondria. This cascade, known as mechanotransduction, results in the production of growth factors and proteins that promote healing. Studies have shown that ESWT can induce osteogenesis, enhance bone density, and stimulate the proliferation of periosteal cells, all of which contribute to tissue regeneration. ESWT is primarily used for musculoskeletal conditions, especially those involving bones and tendons. Common indications include pseudoarthrosis, delayed fracture healing, bone marrow edema, osteonecrosis, plantar fasciitis, Achilles tendinopathy, calcifying tendinitis of the rotator cuff, tennis elbow, and wound healing problems. The choice of device and energy level depends on the specific condition and the depth of the target tissue. ESWT has become a valuable conservative therapy option for these challenging cases. One of the strengths of ESWT is its safety profile. When performed as recommended, ESWT is generally safe with only minor side effects such as pain during treatment or small skin bruises. Severe complications are rare. However, certain contraindications exist, such as severe coagulopathy, pregnancy, or active infection at the treatment site. It's important for practitioners to be properly trained and to follow established guidelines to minimize risks and ensure optimal outcomes. ESWT's earliest and most established use is in treating delayed bone healing and non-union. High-energy focused devices have shown the best results in promoting bone regeneration, as demonstrated in both animal studies and clinical trials. By stimulating osteoblast activity and increasing bone density, ESWT offers a non-surgical alternative for patients with challenging fractures. Evidence continues to grow, supporting its role in orthopedic practice. ESWT is widely used for tendon-related problems, including plantar fasciitis and Achilles tendinopathy. Studies have shown that both focused and radial devices can be effective, especially when combined with physical therapy. For conditions like calcifying tendinitis of the rotator cuff, high-energy ESWT has demonstrated superior results. The therapy helps reduce pain, promote tissue healing, and restore function, making it a valuable tool for managing chronic tendon disorders. Beyond bones and tendons, ESWT has been explored for conditions like osteonecrosis, bone marrow edema, and even trigger point therapy in muscles. While the evidence for some of these uses is still emerging, initial studies and case reports suggest that ESWT can provide pain relief and promote healing in a variety of musculoskeletal disorders. As research continues, the list of potential indications may expand further. patients undergoing ESWT, it's important to understand that healing takes time. While ESWT can accelerate tissue repair, basic principles like immobilization during bone healing must still be followed. Patients should be informed about possible discomfort during treatment and the need for post-procedure care. Clear communication between clinicians and patients helps set realistic expectations and support successful outcomes. Proper training in ESWT is essential for safe and effective treatment. National societies often organize courses to ensure practitioners are familiar with device operation, patient selection, and legal requirements. Following published guidelines, such as those from the International Society for Medical Shockwave Treatment (ISMSD), help standardize care and minimize complications. Only qualified professionals should perform ESWT, ensuring the best outcomes for patients. ESWT continues to evolve, with ongoing research aimed at refining device technology, standardizing treatment protocols, and expanding clinical indications. While more randomized trials are needed to strengthen the evidence base, ESWT remains a promising conservative therapy for many musculoskeletal conditions. As our understanding of its mechanisms grows, ESWT is likely to become an even more integral part of orthopedic and rehabilitation medicine.